Okay, so we are starting with thyroid storm. Thyroid storm, right? And then with the thyroid storm, I said that it's a life-threatening complication of hyperthyroidism, right? So it's a complication of hyperthyroidism where there is an abnormally high levels of T3 and T4 hormones, right? So it's a life-threatening complication, right? So it means that it's a serious condition. A patient with this condition may be brought in either unconscious or in coma or with seizure, right? So it means that you need to manage the patient well to prevent further complications. Causes of thyroid storm include surgery. So it can follow thyroidectomy. Right. Other causes include diabetic ketoacidosis, preeclampsia, trauma to the thyroid gland, infection such as thyroiditis, right? So recurrent thyroiditis, right? And then withdrawal from the anti-thyroid medications. All these can lead to thyroid storm, right? Signs and symptoms most of the time is the central nervous system signs and symptoms. So restlessness, agitation, confusion, delirium, lethargy. Sometimes they can go into coma. There can be convulsion, seizure, right? There can be high temperature, hyperthermia, right? Or hyperparesia. And then diarrhea, nausea and vomiting, etc. Okay, so management, since it's an emergency case, most of the time you manage the presenting signs and symptoms. So if patient comes in coma or patient is brought in unconscious, you know how to manage the patient, right? So most of the time you start with the airway management where you assess the airway, you check the SpO2, suction where necessary, you give oxygen, right? You loosen tight clothing, right? If patient is semi-conscious or unconscious, you turn the head to prevent the saliva from choking the patient, right? You assess vital signs every 15 minutes, you move to 30 minutes, right? Depending on the condition and then the severity of the patient's condition, right? And then apart from that, you also give the anti-thyroid medications, the IV ones, depending on the condition. If the patient cannot swallow, you can give the IV anti-thyroid medications. We've mentioned the anti-thyroid medication. You check the level of consciousness or assess the level of consciousness. In case there is seizure, you have to manage patient on FIT chart, right? So FIT charts, you have the type of seizure, right? The parts involved, the duration, and then the management that you give, right? And then where there's high temperature, you tap a sponge, you give prescribed antipyretics, right? And then you also check RBS where necessary, so that you know the IV fluids, and then the BP, so that you know the IV fluids to give, right? So it is that you have to set a line, you have to take sample, you have to give prescribed IV fluids, right? And then you give prescribed anticonvulsants if patient is having seizure, right? You have to mount your side wheels to prevent patient from fall. If there is difficulty in breathing, you put patient in semi-fowler's position, right? And then you also assess for the level of consciousness. I've mentioned that, right? So basically it depends on the condition. The thyroidectomy, you manage patient preoperatively under the physical preparation, the psychological preparation, and then the physiological preparation. It's not different from the other pre-op management, right? So psychologically, you have to reassure, educate patients on the condition. You introduce patients to other people who are undergoing the same surgery, right? You talk about the pain concerns, how you manage or how the patient will bear the pain, right, at the theater and then after the surgery. Then you also talk about some pre-op and post-op procedures that will be done, right? And then you allow patients to express feelings and concern. You the economic support, where you find out how the patient will pay for the surgery. If not, you find ways of helping the patient to pay. Spiritual support, where you invite the spiritual leader, and then all that. Okay. And then physiological, vital signs, lab investigations. You know the lab investigations to do for someone with hyperthyroidism, right? So thyroid function test, thyroid scan, MRI, CT scan of the thyroid gland, and all that. So these investigations should be done before the surgery. Nail per